Welcome to Hospice Explained. This podcast is intended as an educational aid and is only a resource to begin to understand the end-of-life season. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please always seek advice from your physician or qualified members of your healthcare team with any questions regarding a medical condition.
Hello and welcome to Hospice Explained. I'm your host, Marie Betcher. I'm a former hospice RN, and I started this podcast to help continue the education for patients and families about hospice and the end-of-life season. In addition, Hospice Explained is partnering with the Cloud9 Care system. When patients remain in the same position for extended periods, they're at high risk of developing pressure injuries, commonly known as bedsores. The Cloud9 Care system is designed for patients and caregivers. It consists of a double-layer sheet, both layers featuring low friction and moisture-wicking properties. They also have pockets to hold pillows, wedges, or other inserts in place. If you would like to order, please reach out to cloud9caresystem.com or reach out to me, Marie, at hospiceexplained.com. If you do reach out to the website, please let them know this is a Hospice Explained referral. On this episode, I have returning guest Peter Abraham RN. Peter is an author of many books, up to 48 now. They are on Amazon.com, Peter M. Abraham. In addition, CompassionCrossing.info. Peter has many articles to educate the listener on hospice. Welcome back, Peter. I don't know what I want to call you, a former hospice nurse, but Peter is not currently working in hospice, but Peter is writing book after book after book. And I encourage everyone to go to Amazon and Google Peter's name, and you can find, what are you up to? How many books now, Peter?
They will say 50, but it's actually 48 because two of them were rebranded.
Okay. So there is any number of subjects you want to touch on to learn about hospice. Peter is probably got it. And if not, send him a message or find him on Facebook and tell Peter you need that book. But what I brought Peter on today for is I saw on a Facebook group that we're both in, somebody talking about being scammed. And that just hurt my heart, honestly, because when you have a loved one dying, the loved one and whoever is caregiving, you're really already emotionally at a hard place. And so it just really angers me, honestly, personally and professionally, that anybody would hurt or scam somebody. So Peter, let's just start with, how do you know you have a legitimate hospice agency? How are you going to tell?
The good agencies are going to communicate well from the very beginning, and they're going to follow through with what they communicated. For example, if you set up an informational visit, those are commonly how you do your interviews. The family will call and say, I want to know more about your hospice agency. And I recommend everyone who has the ability, where there are two more agencies, call them, ask to speak to one of the nurses. The most likely nurse you would be assigned is the best case. Ask to speak to the social worker. You could have them both come out or individually, and have that information visit. Have them explain their services. Those who say, I'm coming out for this visit, I'm going to be there between this time and that time. It's an approximate because we can't control construction, or it showed Google Maps or Apple Maps, whatever mapping tool that you happen to use. This is how long it'll take, and oh my word, something happened. But are they like, let's say they're running late, or are they calling you to tell you that they're running late? Are they treating you professionally, politely, right from the get-go? Because those agencies that are falling through the gap, the low care, no care, they're going to be failing early on, and that's going to show up as, could be as simple as asking, how often are you going to visit? You might hear once a week, and then, well, is that on schedule? And well, we'll show up when we show up. That should be a red flag. Are you coming Mondays, Thursdays, or are you just coming Wednesdays? Can you name the day of the week? I understand you, so that your listeners know, Most of the time, we can't guarantee arrival times, but we should be able to say these are the days of the week that we're coming within this hour or that hour. And by the way, I'm going to call you at the beginning of the day between this time and that time to give you a ballpark of when I should arrive.
Exactly. And right away, I would ask, what are the services I can
Hmm.
expect? You know, and you can call, a lot of hospices will do just an information. They often have nurses that take calls. I don't know if my loved one needs hospice, but these are the symptoms. And the nurse usually can say, you know, I think we ought to get somebody out there. And then that might be the
Hmm.
admission nurse if you're not in the hospital, for example. But like you said, there's not a guarantee on arrival time. I have been to some I went to one. This is a interesting story. I live in an area with a lot of new construction. There's older homes, of course, but a lot of new construction. And so I was GPSing my way in, and this neighborhood not even remotely in the map. I ended up so I was probably an easy hour late. And it turned out, that first person that comes to your house before they come, if you ever can tell them, no matter what GPS says, don't turn left, go straight and do the next left. Those are very important pieces for hospice nurses.
A- Absolutely.
Well, so poor care, no care. That's just what it says. They're not doing a good job or they're not literally caring for you. So, what I saw, the specific post, was somebody thought they signed up with hospice and it wasn't, was it the case that it wasn't even a real agency?
That part I don't remember if it wasn't was a specific agency. Sadly, there's been like two or three cases in the same group where somebody called in, and the nurse, somebody helped them on the other end via phone, but a nurse was never sent out. And it was a type of case where a nurse should have been sent out, my opinion only. But there were other cases where the daughter was saying their father, who has COPD and or lung disease, the hospice was saying that they wouldn't cover the inhaler, they wouldn't cover oxygen.
I remember that one.
And so these low care, no care can vary from when personnel come to help to getting the supplies they need to having the appropriate medications covered. And what doesn't help is, even though Medicare does have sites that have a whole benefit manual, it's not written in a way for the consumer to understand what are their rights. I'm so glad for Hospice Explained and the work that you do, because it helps bring awareness to the blessings hospice can give, but also there are issues that we need to work through as an industry where it's like danger, danger.
Thank you, Peter. I appreciate you acknowledging my work. And I do want to agree with Peter that you just have to know what your rights are. And Peter writes a book about this. It's something you can research. What are your rights? Peter, why don't you give the top 3 or 4 rights in what is a patient's right for hospice care?
Going through the book now, it's called Understanding Your Rights in Hospice Care, a Guide for Patients and Families. And I wrote this either late last year or early this year. So you have the right to participate in care planning. What the care plan means is, how often is a registered nurse going to have scheduled visit. So hospice is 24/7. One of the most misunderstood things about hospice is they're not in your home, or unless it's a hospice owned facility, they're not in a skilled nursing facility, assisted living facility. 24/7. They're not staffing, they're not replacing the staffing, they're not replacing family or the family caregivers. You have a right for 24/7 care, but part of the care that you're getting is you're assigned a registered nurse case manager that should be the same person throughout the entire, from start to end. Hopefully, there's not a lot of turnover. That's typically a bad sign. You have the right to know how often they're coming to your home. You have a right for a ballpark of how, like, even though you don't do blocks of time, You should be able to say, what's your average time for this type of case? We're looking at 30 minutes, which is Medicare's minimum, or 45, or whatever. You have a right to say, I want to have a care plan meeting to meet with the team, including being a part of that IDT meeting. So every I think it's every 14 days, it might be 15. But I think most hospices are doing 14. They have an interdisciplinary team meeting where the medical director, the social worker, the chaplain, one or more registered nurses have to participate. Most families don't know that they can say, I want to participate when it comes time to talk about my family, my loved one. They could actually have a call to be part of that segment for the IDT meeting and participate in that. Rights for the regular communication update. The medications, there are medications that should be covered by hospice. So if somebody comes on with lung disease, which was a case late last year, early this year, their inhalers should be covered, unless it's an experimental treatment, like several $1,000s. I did have one of those for pulmonary fibrosis. Their regular inhalers should be covered. Their nebulizing treatment should be covered. The nebulizing machine should be covered. If they're coming on with heart failure, this is a very common question in the forums. There were several this past weekend. Their blood pressure medication should be covered. As much as I believe no one should ever be on a statin, my personal opinion, the statin should be covered if they're coming on for heart failure. Their diuretic should be covered if they're coming on for heart failure.
Peter, I think you're giving some really, really good ideas on some basics.
Mhm.
They also have a right to be treated well
Correct.
and treated with compassion.
Yes.
And they have a right to, they technically have a right to refuse spiritual care, but I highly encourage people to give those folks a chance because those spiritual, pastoral folks respect your difference in opinions or belief system. So they really are an interfaith or, if you don't have quote unquote belief in a higher power, however you like to choose to say it, they're still going to respect your opinion and your belief system and they can give you some comfort and guidance towards, sometimes we all just need some resolution of experiences, forgiving others, forgiving ourselves. They can really help you with life review.
Absolutely. And with that, and I do want to come back to the chaplain, but let's say you're having a nurse come and they're not meeting your expectations for the level of care. You have the right to call the hospice agency and I want to have a different nurse.
Audience, I do want to just pause and say sometimes it's not always that easy to change staff. Sometimes you really have to look at, is this my expectations of this person? Was this just a bad day for them? You can always give somebody another chance. I'd like to
Mhm.
have a conversation when they come visit again. Or you can say, let's talk on the phone. And that sometimes you just need a different nurse or a different chaplain or a different social worker or a different bath aide, maybe they're just you felt like
Correct.
the bath aide was too rough. I mean, everybody can be a little different style. And so it is okay to ask for a different staff member. We'll say but the hospice may not, depending on where you're located, have other staff members. So I think we have to.
Correct. That's the challenge too in terms of expectations, because I know when I covered York County, Pennsylvania, that's a rather large area. There was a certain section where like it was just me. And so, I would try my best to not be a people pleaser, but to meet expectations. But the catch is if they didn't like me, they had a hard, the agency had a hard time finding another
Oh,
nurse that would actually
absolutely.
be able to go to that distance based on where they live. But I do want to drop back just a little bit, even though we're not talking on the scam subject. But the hospice chaplain is the most underrated person on the entire hospice team because of the stigma of they're going to, I'm an atheist and they're going to try to convert me, or I'm part of this religion and they're going to try to convert me, not understanding that they are not only are they non-denominational, non-connect. It's not that they don't have a personal faith, but they don't go in with the intention of changing anybody. They are there to listen. And I have so much respect for the chaplains because I have had cases where I couldn't be there as long as I would have loved as a nurse, but the chaplain was able to spend far more time providing comfort. So I hope everybody just give them an opportunity.
Absolutely. Absolutely. And I think, on that same vein, sometimes people don't want a bath aid. They're private. They just, "Oh, I
Mhm.
can handle it," or "I can take care of mom," or, the caregiver says, "No, I wanna encourage you to take up," anybody in the team, they are just there and geared toward helping with end of life, and the bath aids are amazing. The massage therapist, it's not a aggressive massage, it's a comfort massage, music, they'll play what you want.
Mhm.
Hopefully, possibly pet therapy. You haven't had a dog in a few years. And I just do wanna pause and plug for Pet Peace of Mind that if you do have a pet and you are concerned about end of life for yourself and or a loved one and they have a pet, that Pet Peace of Mind, a lot of hospices volunteers help with this to rehome and not put these pets in the pound.
That's so important, and I'm glad that you brought that up. We both help out in a number of different social media groups. Recently, in an Alzheimer dementia group that I participate in, they were talking about a loved one's pet, and I just said, they did keep them with the loved one who's terminally ill as long as possible, but please, that pet needs to be rehomed because I see too many on the negative. So I'm so glad there are services out there to rehome pets.
Absolutely. Absolutely. Well, so we've talked about what to watch out for. We've talked about rights. We've talked about, if you're concerned, I'm going to be brutally honest. If you're a caregiver or even a patient and you have some major concerns, pause, research. Thankfully for the internet, most of us have quick quick ability to research, check some reviews, check for legitimacy. So that's a good question. Peter, how are you going to tell if your hospice is literally legitimate and not just a full on just a name in a warehouse on a warehouse?
So name of the warehouse, that's where I would go to the Medicare.gov slash care hyphen compare. So www.medicare.gov slash care hyphen compare and look up the provider should be listed on that site. My hope, no pun intended, is that starting October 1st, the Centers for Medicare Services, Medicare governs hospice, whether you're the loved one who is about to receive or is already on hospice. It doesn't matter what insurance is paying for hospice, or maybe they're receiving pro bono services. Medicare governs hospice. And prior to October of this year, even today, as the date of this app is that you're recording, hospice uses the hospice item set to judge quality. Well, CMS is moving to what's called the HOPE, literally the word hope, as in having hope, the HOPE tool, October 1st of 2025. And that's going to put a tighter rein on quality expectations for hospice providers. It's like you have the admission visit. It's going to have to meet certain expectations above and beyond what was in the past. Then there has to be an update visit within 15 days, another update visit within 15 days. So you're getting like, and this is going above and beyond the regular visits, although certain times you can team up. If there are certain symptoms going on, let's say they have pain of 4 out of 10, and especially if it's higher, or nausea and vomiting where it's rated similarly, they have to receive a symptom management visit within a certain period of time and then a follow-up visit after that. So my hope, again, no pun intended on the word, is that once hospices are set up on that October 1st, 2025, as we move forward towards the end of this year into next year, we're going to see a major, I'm hoping, quality improvement because the payments are going to be based on those quality metrics. So they're going to be on a tighter gun. So in terms of families, is this operating out of a warehouse? Is this a make-believe hospice agency? They should be registered with Medicare.gov/care-compare. But that's too during your interviewing. The catch-22, you can't necessarily check references like talk to other hospice patients, but they should be able to give you provider references in the community where you can call the provider. This is where asking for the nurse and the social worker to be interviewed. This is where like asking, do you have a massage therapist? Could I talk to them, even if it's on the phone? Could I talk to the music therapist? Could I talk to the pet therapist? And hopefully, with the more foot on the, rubber on the road, so to speak, there's more proof that it's real.
Good advice, Peter. What about, let's go talk about rural areas. You talked about taking 3 hours to drive to somebody. Now, were you the only hospice that served that area?
So it was weekend on call. So most hospice agencies, when they have somebody on call, the smaller agencies will literally have one nurse. And just pausing to how do I word this, because I call your clinical manager, but they're not your real backup. Because to me, a real backup can get up in their car and go out and see somebody. But sometimes your backup is they'll walk you through stuff on the phone. So some of the smaller agencies are just one person, and this happened to be one person for 7 counties. That was, if I was on call. And so I covered York County. That was my county where I have patients assigned to me. But this particular patient happened to be at I don't even know if that was in Adams County. It was beyond Gettysburg, Pennsylvania. If anybody knows the area, I think it was in Fayetteville, Pennsylvania, where they were literally 3 hours away from where I live. And so rural hospice, when I had somebody in my county, like Monday through Friday or scheduled visits, my furthest patient was an hour away, one-way drive.
Yeah. And that's in good weather, right?
Correct, and that's in good weather. And then with that, and to give you an example, and this is me. I'm not, and I would love. Everybody's different, and I can't say I want people to be like me, because I'm not saying that would like I'm not saying I'm the best or the. I strive to be what I would expect others to be to me. So I remember a case where I had a patient in Delta, Pennsylvania, where their Delta is right close to the Maryland border, and I was like, why couldn't you go to Gilchrist Hospice? It's literally across the border. Like you can go there, because we it was one of those cases where I knew the patient go into crisis in a heartbeat. They signed up. They went into crisis less than a week of being on service, so we didn't get to prove how good we are in terms of trust. And they called me. I get the call. They are my patient. I'm leaving now, but you're an hour away. And it's like, even though I told them that on my admission visit, the post-admission visit, they're like, are you kidding me? I'm not EMS. I can't do the siren. I can't speed. I have to obey the law. And so I ended up walking them through calling 911. So that's part of the harsh realities is, even when there are other choices, we're not EMS.
So let's pause and say what that means. Emergency medical services.
Right.
So if you call 911, that's who responds. Usually,
Right.
EMTs, emergency medical technicians versus paramedics are sometimes dispatched. But,
Yeah.
that's the reality. Hospice is not an emergency provider. It does cover, like you said, the 24/7, after hours, weekends.
Hmm.
Peter's correct. Emergency services are meant for emergencies. And so let's just clarify, emergency medical services, EMS, is when you call an ambulance, when you call the fire department to come give your family member help. We do not have the ability to, like you said, go lights and sirens and get there super fast.
Correct. And how I would explain that to families is, if you call, 911 and they're going to have the police come out, there's different police stations in a geographic area. So in any one county or province, there might be anywhere from 2 to dozens of fire stations, police stations, and the TV shows where they're coming down the poles and so on. But with hospice agencies, I've had cases where a person would ask me, "Where's your hospice agency, the office located in relation to where they live?" And I would say, "Okay, I'm going to answer your question, but there's actually two questions here. There's the where's the agency located physically in terms of a physical address? You're going to go there and meet with the director and other like office personnel. But then there's where's the nurse coming from and where's the aide coming from? We're coming from our home. We don't sit at the office waiting for a phone call, and then and that office is not necessarily centrally located, and it's not like you have two or three or four offices in that area like stations. So that's the catch 22 in terms of realistically looking at things.
It is. You might have a nurse one night you call, they come out, they happen to live 5 minutes from you. It just happens.
Mhm.
And sometimes people live farther out and this is their life. They're used to it and they commute for an hour to get to you. It's just it can be kind of random on who's there and who's working and where they live.
And if I may, in terms of like what to do or how to gauge things, is you call, they're supposed to be available 24/7. You call. Some hospice agencies use an answering type service. So you should be getting a call back, within 15 minutes or less from a nurse who's able to try to walk you through things. Part of the right is you have the right to say, I want a physical visit. Some people don't know that they could ask, I want to have a nurse come out. I know you're trying to walk me through. I'm going to try to, and I do encourage people. Like I would tell, I want you to give the liquid, this is how much liquid morphine to give, or if some kids have liquid haloperidol, I want you to give this much, and here's how to tell the difference between this, halidol and the morphine. I want you to follow my instructions, and I'm coming out. Like I would be the one telling, if sometimes I had a family, oh no, no. Unless they were telling me they're going straight to bed, it's like, I think you'll feel better if I'm coming out. The family has the right to say, I want to have a nurse come out.
Let's talk about bring this into we're talking about rural hospice. You're not happy with the service. And maybe it's not because you're not happy, maybe it's because you're not getting the service that we've talked about that you should expect and you should get. What are those options? What could somebody do if they're just absolutely receiving poor care, no care? Whether they're rural or not, let's give somebody some options.
So the biggest thing that would hope everyone remembers is hospice is an elective service. So you have the right to revoke at any time. Now, there's typically a small amount of paperwork to fill out, but you're not holding back by filling out the paperwork, meaning if your loved one needs to go to the hospital now, this second, and I don't mean that EMS would be there that fast, you have the right to call and let the hospice, know after you've handled the emergency, then call the hospice, 911's on their way, I'm revoking now. Can you send me a DocuSign or I'll sign as soon as I can? You have the right to revoke, go to the hospital. And the hard part about the hospital, they're not always trained on how to maintain comfort, but I do strongly believe there's many resources out there, especially through social media nowadays, where you can get guidance from many hospice nurses and workers that are freely donating their time. They're not charging you for this. My loved one just revoked and was sent to the hospital. What do I tell the hospital? What do I tell the ER doctor? How do we work together where we could just have the best case possible given the circumstances?
Absolutely. Start asking questions. One of your resources at the hospital, it'd be to ask for a social worker consult.
Hmm.
To say, I just left my home. We were on hospice. Here's my problems. Or can you help me find alternatives? And sometimes alternatives, we haven't discussed this yet, but alternatives could be not having hospice in your own home. It could be hospice. It can be in the hospital. I think you mentioned the words GIP earlier. That's like a general inpatient.
Yes.
Sometimes it's done in the hospital. It really can vary from situation to situation. But maybe they discharge you to a place where there's more care, more access to services, and that's what our social workers, they are key to knowing those details of what is in the area and what they can get you help with.
And with that said, just following through, you go to the hospital social worker, and maybe you're in a geographic area that there's only one hospice provider. However, there are one or more palliative care providers. That might be an option too. Because even though generally I wish there was a different word for palliative care, because you have palliative care and hospice care. They're both palliative care, which can add to confusion. Hospice is palliative care at end of life, but there's generalized palliative care that's just working through the symptom management. They may or may not have all of the end of life training that hospice workers have, but they could often be a bridge. And if they're your only choice, if you only have one hospice provider in town and they're not meeting your needs, maybe a palliative care provider can be that type of bridge.
Absolutely. A very good alternative. Well, Peter, we've talked about a lot of different subjects. It's a lot of information, and I think we're at a good point. How can my listeners reach out to you if they're interested?
So, first off, I have a website, compassioncrossing.info. So, compassioncrossing.info. There are over 400 free articles, including is it too early to start hospice? How do you pick a hospice provider, including the different questions to ask the provider? Topics on different services offered by hospice providers, such as massage therapy, music therapy, and so on. In the resource section, recommended reading section of that website also goes over different books I've written. I'm on Amazon.com. If you look up Peter M. Abraham or just Peter Abraham, BSN, RN. If you're finding fiction books, it's not me. There are other Peter Abrahams. But if you were to see hospice books and dementia caregiver books, you probably found the right Peter on that. And then lastly, if you want to send an email, author, like authoring a book, author at the @ the numeric 2 Abraham.com. You send me an email, find me on Facebook. I'm also on LinkedIn as Peter M. Abraham on LinkedIn. I just love helping people when I can. So I do want to encourage, reach out. If I can offer help, I'll let you know. If I can't do it freely, I'll let you know, but I've helped a number of people freely with different questions. I believe, just as Marie with Hospice explained, we're here trying to help one another through very difficult times.
Absolutely. Thank you, Peter. Appreciate you.
You're very welcome.
Thank you for joining me on Hospice Explained. Think about ways you can make a difference in someone's life. Also, please subscribe and share this podcast with anyone who would benefit from listening. Thank you.